Hi guys, it's Cheyenne here. During my last EDS Q&A, I received a couple of questions about pelvic floor therapy. I did not include those in that Q&A because the responses would have been quite lengthy and this deserved its own separate video. So I'm going to discuss pelvic floor therapy, what it is, how the process went for me, and to talk about some of the exercises. Pelvic floor therapy is a form of physical therapy that targets the pelvic floor. Your pelvic floor consists of the bladder and bowels and all of the nerves and muscles that allow those body systems to function. The goal is to provide the patient with biofeedback, strengthening exercises, and relaxation techniques to help a patient manage issues with urination and or defecation like incontinence or constipation. It can also be used for sexual problems and chronic pelvic pain. There are many reasons someone might require pelvic floor therapy. They could have a spinal cord injury, they could have pelvic floor dysfunction, secondary to any number of conditions. I am in pelvic floor therapy for a couple of reasons. I developed signs of neurogenic bladder when I was 8 years old. However, I was not officially diagnosed until I saw an autonomic specialist at age 14. Neurogenic bladder causes urinary retention. Mine is also accompanied with UTI-like symptoms, but I constantly feel like I have to pee. It burns when I go. At night, I have frequency and I sit there, and when I try to go, I have to press down on my bladder or bear down as hard as I can just to get urine to release. Around the time I developed pseudo-obstruction problems with my bowel, I was around 19. It was in 2017. I would feel like I need to go. This is kind of awkward, talking about these bodily functions, but unfortunately that's just part of this topic. So if that kind of talk bothers you, don't watch this video. So back to the bowel problems. Around the time I developed pseudo-obstruction of my bowel, I would feel like I would have to go to the bathroom, number 2, and then it was there. Or I had gas and it would be there, but I would not be able to release it. And once I had my subtotal colectomy after my volvulus, those issues just increased tenfold. Rather than sporadic, they were constant, and I would have embarrassing accidents. If the stool was not formed and it was like diarrhea, which is actually what I have the majority of the time, I think people have a misunderstanding to think that if you have intestinal failure, like from pseudo-obstruction, that you're constipated, and while that is the case with the majority of people, diarrhea is also a prominent symptom. It depends on what kind of contractions your bowel is doing, and when the bowel senses there is an obstruction, it sends all of the water in your body to the bowel to flush that obstruction out. So if you have a partial obstruction, then you're still able to have the diarrhea go through that. But the solid stuff, it kind of stays stuck up there. So you can also have where you will have diarrhea below the obstruction. So even when I was completely obstructed with a mechanical obstruction, even with my volvulus, I had diarrhea multiple times that night. And I was whisked away to emergency surgery. I realize that's totally off topic, but oh well. Because of these accidents, they were not sure if some kind of nerve was damaged during surgery or if it's just one of those weird Cheyenne things. I would also like to add, since the progression of my GI problems, my bladder problems worsened at the same time. My oncologist referred me to pelvic floor therapy. Until we find a more concrete answer, right now this is attributed to Ehlers-Danlos syndrome, as the tissues of the bladder are not normal. Instead of communicating to the body that the bladder is full and needs releasing, instead it stretches and stretches and stretches. Dysautonomia also has a role. When the autonomic nervous system, which controls the bladder, is malfunctioning, pelvic floor problems can range from one extreme to the other. You could have moments of frequency and you just can't quit going, and then you can have moments where you can't go for the life of you. Mast cells contribute too. When I am flaring, if I am very, very triggered, my UTI-like symptoms increase because of the inflammation in the bladder. And then when mast cells degranulate, depending on what mediators are releasing, they impact the autonomic nervous system, which furthers the issues of the pelvic floor. Okay, so to begin my pelvic floor therapy, I was first referred to a urologist. Urologist deals with the bladder. Although my doctor wanted me going for my bowel, and that was the main goal we were trying to accomplish, I started with urology due to the facility that I would be going to did not offer the bowel portion, and the one that did, it had a 6+ month wait list. Our hopes were that if we focused on the bladder, it would improve the bowel too. That has not been the case. My current pelvic floor therapist is doing the course for the bowel section, so I should be doing that next. Once I am released from the pelvic floor therapy geared towards the bladder, I will be in the bowel one. She's actually getting her certification this month, which I am excited about. In my initial appointment with the pelvic floor, they started with an assessment. In the first assessment, they asked me questions about my bladder. For example, they ask, how many times do you urinate in the night? How many times would you say you urinate throughout the day? Do you have to strain to urinate? Do you have to press down on your bladder to urinate? The next section is gynecological questions. They ask you about pain during intercourse or pelvic examinations. Even though I'm not doing the bowel portion, because these organs are grouped together, they ask you about your bowels. They ask you if you experience constipation or diarrhea. How many times do you use the restroom? Do you feel like you have to remove stool with your finger when you're using the restroom? Do you use the restroom without knowing it? Then, as part of my assessment, the therapist assessed all of my muscles. She began with my legs. She would put her hand and I'd have to raise my leg, and she would try to push down to see how long I could hold that without her being able to push my leg down, which is not very long, just to FYI. So this next part was very uncomfortable for me. I was not expecting this, but the next portion of the pelvic floor therapy is the internal examination. Yes, internal examination. I was not expecting this. I'm not, now that I'm thinking about it, I'm not sure why I wasn't expecting this, because it makes logical sense, but the therapist performs an internal assessment. So what she does is she sticks a gloved finger with lubrication, although we opted not to go with lubrication for me because of my allergies. This examination is a bit different than a gynecologist. There's no speculum involved, just putting that out there. But what the therapist did is she inserted a gloved finger to just feel all of the muscles of the pelvic floor, because she has access to those from inside. Before she did this, she took out a diagram. It was actually a physical diagram of the pelvic floor to explain exactly what she was doing, to make sure that the process was as comfortable as possible for me. I wouldn't say she goes really deep. She started from the outside and makes her way further in. And during this examination, I would have to cough to see if certain muscles contracted. I would have to do Kegel squeezes to see how long I could hold it, despite the uncomfortableness. After my first assessment, the therapist explained that there are some muscles in my pelvic floor that are too weak, and there are muscles in my pelvic floor that are extremely tight. And she was not surprised by this, because of my bowel and bladder issues and my history of surgeries. There's been quite a bit of trauma to that area. The body senses that there has been trauma, and it's like, hey, I don't want this to happen again. And so it just tenses up. And all of these muscles, they stay tense, and then they contribute to the problem of not being able to release the bladder, or not being able to release your stool, or vice versa. The weak muscles cause you to have incontinence of urine and or stool. In the next step, I assumed that the following appointments that the internal examinations would be done. At least half of my pelvic therapy appointments, and I've been going for a few months now, have entailed manual relaxation techniques. She could not begin the strengthening exercises until my muscles were relaxed. So in order to get these muscles to relax, she again takes a gloved finger, inserts it down there into the pelvic floor muscles, and she manually presses each of the various pelvic floor muscles to try to relax them. This took about 30 minutes, and the remainder of my appointment consisted of stretches to help relax the pelvic floor and to open up the hips. She recommended this tool to maintain at home the relaxation of the pelvic floor. The VIBIDO active Kegel exerciser set, I will put the link in my description. I have not personally tried this. It looks kind of awkward, and she was laughing in my appointment because it is kind of awkward, but she said that that is her job, is to inform patients of these various tools that they can use, and if this might be helpful for somebody else, I will put that link down there. Once my muscles were consistently relaxed for multiple appointments in a row, we began the strengthening exercises accompanied with breathing. My pelvic floor muscles are uncoordinated, according to the therapist, and the breathing exercises are meant to contract and lengthen the pelvic floor. This is where biofeedback is handy because it increases your body's awareness of its functions and what it's doing. I was encouraged to try these breathing exercises while I am trying to urinate or use the restroom. These exercises are not rigorous. Most of them can be done from a laying or seated position. There are a couple of hip exercises that are standing that I find helpful, but the bulk of them are from a seated position, which is ideal for POTS. If you have orthostatic intolerance and you tend to go kerplunk upon standing, these exercises are for you. The only equipment necessary is a resistance band. I purchased a mat that I can sit on the floor to make this more comfortable, but it can be done from the bed. She also uses a ball that you put between your legs, but at home you can use a pillow. I try to do these every day or at least a few times a week. I go to pelvic floor therapy 1 to 2 times a week. Ideally, it is 2 times every week, but with my health currently in the sad state of affairs that it's been in, I'm only able to do, like for 1 week, I'll go once a week, and then the next week I'll go 2 times a week, and then the next week 1 time a week. And I have had appointments where I've had to cancel multiple appointments in a row, like if I've been in the hospital. Has pelvic floor therapy helped me? Pelvic floor therapy has not helped my bowel situation at all. None whatsoever. I've noticed no improvements there. However, I have noticed a difference in my bladder. When I have a flare of pseudo-obstructions, my bladder worsens. However, in the time in between obstruction episodes, I do have improvements. It's not as difficult to urinate, and I don't have to strain as much as I was. In the meantime, while I was actually in pelvic floor therapy, I had anorectal manometry testing. This helps assess the pelvic floor from a bowel standpoint. My results there were abnormal. The recommendation for that was pelvic floor therapy with biofeedback, which I'm already doing, but the bowel part is what is best suited for this. problem, which I will be doing soon, and I can let you all know how that goes once I start that. But for right now, with the bladder, I guess I'll take any improvement I can get, because there has been very modest improvements, but I'm thankful. When you live this chronic illness life, any bit of relief is a victory. I hope this answered any questions that any of you might have about pelvic floor therapy. If you're interested in the process, and don't hesitate to let me know in the comments what you think. How has pelvic floor therapy helped you? Has it not helped you? Let me know. Thanks for watching.